From the book Treat Your Own Chronic Pain, the Chronic Pain Bible for doctors, psychologists and clients. Let's start with a story. Before you get into this book and before you might begin to think that it's a dry subject, I want to share a story so you can see how off track current treatments are and how urgent is the need to immediately start treating chronic pain with this new and proven approach. The client. 9-year-old Sally's parents were understandably distressed. She had been in strong pain for just over 6 months, affecting her joints and muscles over much of her body. She had not been able to go to school at all for the past 3 months, and many mornings had to be lifted from her bed because she was in too much pain and was too weak to get up by herself. Sally would cry with pain at her parents' touch, as gentle as they tried to be. She was an extreme case of complex regional pain syndrome. Under the care of a treatment team at a major city hospital, no progress had been made. The many diagnostic tests showed no cause for the pain, except that it appeared Sally had had exposure to a particular virus in the past that is associated with chronic fatigue and/or chronic regional pain syndrome. At the time Sally was brought to me, she had been booked for admission to a hospital for 2 weeks as an inpatient to undergo a program combining strong analgesics with intensive cognitive behaviour therapy, CBT. Despite there being little or no evidence that this treatment strategy could be the least bit effective compared to placebo. The usual clinical history and discovery took most of the 1-hour session, and Sally offered a pain score of 8 out of 10 down her arms and into her hands. For the final 20 minutes, Sally learned and tested a single treatment strategy which at the time completely eliminated her pain, leaving her merely with a tickling feeling only in her fingertips, which on a scale of 0 to 10 was a tickle with a strength of 2, meaning barely felt, but no pain whatsoever. The following day, Sally went to school and back to sport for the first time in 3 months and has continued to attend school each day since. She does not need to be hospitalised and does not need medication or a course of CBT. The fee for this single session was $180 at the time. Yet the cost to this point of Sally's chronic pain treatment had been in the thousands, albeit mostly covered by Medicare, but which did not result in any improvement whatsoever. What caused this amazing result? Well, I am certainly not a magician. I am not a healer. I am a clinical researcher who actually understands what this type of chronic pain is and how to eliminate it scientifically. Sally was a real-life example of a patient who enjoys a very rapid cessation of pain and represents around 50% of chronic pain patients who get total relief in days or weeks. Others may experience only a reduction in pain at first and require more treatment to fully eliminate their pain. Some people only decrease their pain, yet significantly, and a very small percentage, perhaps less than 5% according to the best data we have, experience no benefit in relation to the pain itself. Regardless, in order to ensure permanent results, of course the full program should be followed until there is a complete return to normal life with no flaring, no medications required. We need to ensure that sensitization is no longer a factor which could re-trigger maladaptive pain signaling. However, current treatment such as medications, physiotherapy, surgery and psychological treatments such as CBT or mindfulness are not doing much, if anything at all, for the great majority of people, but are nevertheless costing over $66 billion every year just in Australia. Sadly, we are not only wasting billions of dollars on pain treatments that do not work or which achieve unsatisfactory results, and the evidence for this failure to help is provided later in this book. But even worse, we are consigning people to lives of pain and distress and failing to return them to their families, communities, and workplaces. Finally, maybe even worse again, we're actually telling people that it's their job to learn to live with it. Honestly, that makes my blood boil. That people in pain are being so cruelly shortchanged. And it gets even worse. People are even being fed the line that the pain is a gift or an opportunity for growth or other such BS. We simply cannot afford, from an economic cost or from a human cost, to continue down the track of medication and CBT and now mindfulness, which is the latest rather silly fad which attempts to blame the client's mindset or attitude for his or her pain. This old approach to treating chronic pain is not only mostly useless, but is also cruel and must stop. This book is an attempt to do something about it.